Let's break it down. The US Food and Drug Administration is preparing to put its most serious kind of safety label, a black box warning, on COVID-19 vaccines. The move comes after internal concerns about rare heart-related deaths and growing political pressure to restrict who can get the shots. I'm Imran, a Middle East-based analyst who follows US politics, health policy, and global affairs. In about 3 minutes, let's walk through what this warning actually means, why it's happening now, and what questions it raises. If you like clear, simple breakdowns like this, please hit subscribe so you don't miss the next one. First, what is the FDA planning? According to reporting based on CNN sources, the FDA is drawing up plans to add a black box warning to COVID-19 vaccines. That's the strongest warning the agency uses on any medicine. It's a bold, black-framed box on the label that highlights serious risks and restrictions so doctors and patients can't miss it. The plan is being pushed internally by Vinay Prasad, the FDA's Chief Medical and Scientific Officer and head of its Vaccines Center. In a memo to staff, he reportedly wrote that COVID shots probably contributed to the deaths of at least 10 children who died from heart inflammation. At the same time, the agency has opened a wider safety review looking at possible vaccine-related deaths across different age groups. Health Secretary Robert F. Kennedy Jr., a longtime vaccine critic, has already changed policy so that COVID vaccines in the US are now mainly limited to people 65 and older and those with certain health conditions. The black box warning would be another major step in that direction. Second, what does a black box warning actually mean? It's important to understand what this is and what it is not. A black box warning does not mean a drug or vaccine is banned. It means regulators believe there is a serious risk that must be clearly flagged, usually for rare but severe side effects or for specific groups of patients. For COVID vaccines, the concern centers on myocarditis and pericarditis, types of heart inflammation that, in rare cases, have been linked to vaccination, especially in younger people. The debate is over how big that risk really is and how it compares to the risk of heart problems from COVID infection itself. At the same time, recent data from public health agencies still show that COVID vaccines reduce the risk of severe illness and emergency visits, especially for older people and those with other health issues. So regulators are trying to walk a narrow line, warn more clearly about rare harms without throwing away the documented benefits for high-risk groups. Quick pause here. If this kind of breakdown helps you understand what's behind the headlines, please like the video and make sure you're subscribed. It really helps the channel grow. Third, why is this happening now? And what are the big questions? Part of the story is political. The current administration has taken a much tougher line on vaccines in general, and key officials are more willing to act on safety concerns even when the evidence is still being fiercely debated. Part of it is about trust. After years of arguments around COVID, some scientists say a strong warning could actually rebuild credibility by showing that regulators are not afraid to acknowledge risks. Others worry the opposite will happen, that a black box will deepen fear, fuel misinformation, and discourage even high-risk people from getting protection they still need. So let's break it down one last time. The FDA is not banning COVID vaccines, but it is moving toward putting the strongest warning label it has on them, focusing attention on rare but serious heart risks while it conducts a wider safety review. Supporters say this is overdue transparency. Critics say it risks scaring people away from a tool that still prevents severe disease, especially in older and vulnerable groups. For individuals, this doesn't replace medical advice. The only sensible approach is to talk to a trusted doctor about your personal risk from COVID, your health conditions, and how new warnings should factor into your decisions. This is Imran Breaks It Down. If you found this helpful, please subscribe, like the video, and tell me your thoughts in the comments. Do you think a black box warning will restore trust or make the vaccine debate even more polarized? Share this with a friend who's following COVID news, and if you're already subscribed, thank you. We'll keep breaking it down together.